Good afternoon, everyone. This is Perry Fry with HDMA, and I wanted to welcome you to this discussion around the Drug Security and Supply Chain Act, or Supply Chain Security Act, excuse me. The reason we put this call together is as we talk to our distributor members and also with many of our trading partners and manufacturer community, it's important for us to make sure that we're communicating with other organizations in the supply chain on the customer side that ultimately will have a stake in implementing this law. There are some things that are coming up for January 1, 2015 for all parties in the supply chain, even though the bulk of the work is going to be done by manufacturers and distributors in the near term. Starting in July, there are some other things that will be taking place in the dispensing community. So we appreciate your time today, and we're going to work our way through this program with a couple of speakers. So my name is Perry Fry. I'm the Executive Vice President, Industry Relations, Membership, and Education here at HDMA. We also have Liz Galina, who's our Senior Vice President of Government Affairs and our General Counsel, and Anita Duca, who's our Vice President of Regulatory Affairs. These two are clearly the experts on our staff on this particular subject. And the person who was changing my slides just left the room. All right. I would also like to remind you that these views that we have here today really are the views of HDMA, and to the degree that you would like more information, we strongly encourage you to talk to your own counsel to make sense of all these things. Lastly, I wanted to let you know that the webinar today is in fact being recorded, and that's why we don't have an open mic for everybody. This way we'll be able to reuse this presentation with other associations, or if you would like a copy for yourselves. The presentation and the audio replay should be available by the end of this week in case there is another use for you. That said, there's a way to submit questions on the program. You'll notice that there's a Q&A box on the right-hand side of your screen. All you have to do is fill out the questionnaire and press send over the course of the event, and certainly at the end we'll be trying to cover any questions you may have. So our program today is going to have some depth to it. We're going to do a bit of a history and background of DSCSA so you know where everything has come from. We're going to talk specifically about what items and trading partners might be preempted, the definitions that are used for the supply chain partners, and responsibilities across the supply chain that are coming up. We also are going to talk a little bit about FDA, noting specifically that they do have a guidance due on November 27th for a big chunk of what we need to accomplish early in 2015. And of course, we'll have time for Q&A at the end. So at this point, I would like to turn everything over to Liz Galina on our staff list.
Great, thank you, Perry. I know that some of you have more background already than others that I can see just from some of the participating organizations, so I'll try and move through some of these slides more quickly than some of the others. Also, bear with me, it's fairly content heavy. We tried to include what we thought would be helpful to you in talking with your members about what their obligations are under the new law. The DSCSA, or Drug Supply Chain Security Act, as most of you all know, Title II of the Drug Quality and Security Act. For this program, we are not going to focus on the compounding portion or Title I of DQSA. The law was signed last year on November 27th, and it was effective immediately upon signature. So some things went into effect right away. Some things have a year mark for their effective date, and some things start January 1 and beyond. So we'll go through some of that as well. Sets out new federal definitions, requirements for all supply chain partners, and also, and this is of note, replaces PDMA and state pedigree requirements that were currently in existence. The law, most importantly, applies to what we call transactions, not so much a term of art or the word as you know it, maybe in business, but a true change of ownership of product, and this is defined in the law, and this is product in finished dosage form and performed by authorized trading partners. All of these things, and we don't go into these definitions, but they're all defined in the law specifically as to who can participate in the supply chain, who can participate in transactions, and when the requirements of DSCSA apply. It is a phased-in approach over 10 years, and then there is more enhanced traceability provisions beginning in 2023. As a little bit of background, and I know many of you are familiar with this already, the law was the result of a multi-year effort to produce a balanced product and an effort to consider stakeholder priorities. So not everybody was thrilled with everything in the law. I think everybody that was part of the legislative process would agree that all stakeholders gave a little and maybe got a little in terms of uniformity across the state. Which brings me to preemption, which is the most, probably one of the biggest underlying things that the law accomplishes, both preemption and pedigree and preemption on the licensure side of things. In terms of preemption for pedigree, which was the traditional way of tracking drugs, mostly in paper form or sort of rudimentary documents that were used to record the movement of drug products through the supply chain. Now, immediate preemption happened of all state laws, regulations, and requirements for tracing products throughout the supply chain, including any record-keeping and pedigree requirements. Federal pedigree requirements under the PDMA, which is the old law, are continuing in force until January 1, 2015. And the reason for this was to really provide a bridge to that gap between the old state laws and the new federal law. So currently, we are following PDMA requirements. January 1, that will change. In terms of licensure, and this mostly applies to wholesale distributors and others that are licensed as wholesale distributors or familiar with this, but it also is just information for you all as dispensers and other healthcare practitioners to know how your trading partners are licensed. And in the case of wholesale distributors, they will now be licensed in accordance with new federal standards. Preemption of state activity for wholesalers and 3PLs or third-party logistics providers that are inconsistent with, less stringent than, directly related to, or covered by the standards established by the Act. That's language right from the statute. It's a little bit confusing, and I will admit there is some question in terms of FDA's interpretation of this, but basically this is a floor and a ceiling for the states once the FDA comes out with their new standards for licensure. In the 3PL case, it will be a new federal licensure. In the wholesaler case, it will be a sort of a federal-state partnership where the states actually license, but based on new federal standards. This is just a timeline for your benefit. It's a little bit small, but I think if you are looking at this on your desktop and in the recorded version, it's probably easier to read some of these. It is also available on the HDMA website. What we just tried to do was lay out all of the major sort of deployment dates for the various requirements throughout the entire 10-year span of the law. So what do your members need to know? I think this was the one thing that we were hearing from associations, particularly on the dispenser and practitioner side, that people were starting to get questions from their memberships, and so that's one of the reasons why we did this webinar. What we try to define here is, how are supply chain partners defined? So, how do you know what kind of entities you're dealing with and what kind of entities are covered by the law? Also, which entities or do your members have certain responsibilities under the DSCSA, and what deadlines pertain to them? And then where can they go with questions? We obviously assume that they will be going to you with questions, and so we can hopefully serve as a resource to you. But also we have some other resources that we'll talk a little bit about at the end of the program too. So how are supply chain partners defined under the law? The most applicable to most of your members is probably the dispenser definition. It sounds pretty straightforward, but it is a little bit nuanced depending on who you're representing. It does cover a retail pharmacy, a hospital pharmacy, group of chain pharmacies under common ownership and control that do not act as a wholesale distributor, or any other person authorized by law to dispense or administer prescription drugs, and the affiliated warehouses or distribution centers of such entities under common ownership and control that do not act as a wholesale distributor. So what does that mean? It's basically anywhere where a product is dispensed to a patient, a pharmacy, a hospital, a group of chain pharmacies, a physician's office would be considered, or physician would be considered a dispenser as well. So really pretty much anywhere that a consumer is getting a drug product. It does not include a person who dispenses only vet products, so only products to be used in animals. So veterinarians are not included in this dispenser definition. Again, wholesale distributor definition, this is also pretty straightforward to what we have seen in the past under the PDMA and under many state laws. This is a, actually this is the manufacturer definition, sorry for that. This is a person other than a manufacturer, co-licensed partner, third-party logistics provider, or repackager that is engaged in wholesale distribution as defined under the DSCSA. And I apologize for the error in the slide, and we'll fix that for your copy later on. Essentially, wholesale distribution, which most of you are familiar with, is distribution of an RX product to an entity or person other than the patient. It is defined in the statute as well, and there are several exemptions from this definition. And then if we get to manufacturer definition, this is also includes a manufacturer under the Federal Food and Drug and Cosmetics Act under Section 505, and also if they have not a co-licensed partner and an affiliate of that manufacturer. And again, I apologize for the error in these three slides. The gist is, you're dealing with primarily the same suppliers that you've always dealt with, the manufacturers and the wholesalers that are distributing product to your members, to the pharmacy or the physician or clinic customers. So what are their responsibilities? What are your members' responsibilities under DSCSA, and what deadlines pertain to you? The first critical one is January 1, 2015. We'll get into some of the other more critical dates a little bit in the program, but this one is just really the first big date out of the gate for the entire supply chain. What it will include for dispensers, though, is verification of suspect and illegitimate products. They must have systems in place to quarantine, investigate, notify their trading partners, and I'll get into some of this in more detail. And then their trading partners must be authorized trading partners. And what that means really is that they have to be doing business only with licensed entities. So for their wholesaler suppliers, they have to know that their wholesalers are licensed properly. Same with manufacturers, they have to be properly registered with FDA, et cetera. So what is suspect product under the DSCSA? This first date for January for dispensers requires your members to verify suspect and illegitimate product. Suspect product and illegitimate product are both defined fairly explicitly in the law, as well as verification and the process that has to be followed. So suspect product is exactly what it sounds like. It's a product for which there is reason to believe that such product is potentially counterfeit, diverted, or stolen, potentially intentionally adulterated, potentially the subject of a fraudulent transaction, or appears otherwise unfit for distribution, so that it would result in serious adverse health consequences or death to humans. The verification definition, and this is where it gets into, there's some differences in terms of what verification is as defined versus what verification of suspect product is. So verification is also defined in the statute, and this is determining whether the product identifier on the package or homogeneous case corresponds to the standard numerical identifier or lot number and expiration date assigned to the product by the manufacturer. There is also a product identifier requirement in the law. It doesn't happen really until year 4 for manufacturers. It will include a serial number. It will be probably a 2D barcode on each individual product package, as well as homogeneous cases, or cases that contain all of the same product and are sealed by the manufacturer. This is a little bit future looking in terms of, we're not dealing with standardized numerical identifiers or serialized numbers right now, but it also will include the lot and expiration, and this is what verify will mean once we have these product identifiers on packages. In terms of verification of suspect product, the requirement to verify those product identifiers will come into play later on. For now, what it will be is really receiving whether you come into contact with a suspect product or receiving a request for verification from the Secretary if they have determined a product could be suspect, the dispenser has to quarantine the product and also promptly conduct an investigation in coordination with trading partners to determine whether that product is illegitimate. An investigation has to include several things. Some of these things, as I mentioned before, will come into play with the lot number or serial number of the product once product identifiers are applied, and will not occur, your responsibilities wouldn't occur until 7 years. But in terms of the initial responsibilities beginning this January for investigations, there will be a requirement to validate any applicable transaction history, transaction information in the possession of the dispenser for the product that is suspect, and otherwise investigating to determine whether the product is an illegitimate product. And we'll get into transaction history and transaction information a little bit later. Once a product is investigated as suspect and then it is cleared, basically you've made a determination, probably along with your trading partners, that it is not illegitimate, the dispenser shall promptly notify the Secretary of that determination, if applicable, and any other, and such product may be further distributed or dispensed in your case. Records, this is probably one of the biggest questions that we get from dispensers and from our members' customers is, what do dispensers need to do with records? And dispensers have to keep records of the investigation of a suspect product for not less than 6 years after the conclusion of the investigation. So now this is not intended to be a daily activity. When the law was crafted, it was thought that we wanted to get at suspect and illegitimate products, the bad product and bad actors that were entering the legitimate supply chain. What we're hoping is that this won't happen often, but dispensers will have to be prepared to kind of follow or have some kind of protocol in place to carry out these requirements. And then illegitimate product, which is kind of the next step after suspect product, is really a product for which credible evidence shows the product is counterfeit, diverted, or stolen. It's intentionally diverted or adulterated, rather, so that the product would result in serious adverse health consequences or death. it could be the subject of fraudulent transactions or appears otherwise unfit. So this is really, though, something that is absolutely bad product. It's no longer suspicious, it's no longer a hunch, but it's been proven to be truly counterfeited or truly some kind of mislabeled, adulterated, et cetera, in the supply chain. And then for illegitimate products, there's slightly different. There's a slight difference in terms of the investigation that has to happen and the steps that have to be taken. Upon determining in coordination with the manufacturer that a product in the dispenser's possession is illegitimate, the dispenser has to do a few things. Disposition the product within your possession, take reasonable and appropriate steps to assist a trading partner to disposition an illegitimate product, and retain a sample of the product if this is something that would help the investigation. All of these things we're hoping will have a little bit more guidance from FDA. You may also probably be hearing from your trading partners, particularly on the manufacturer side, in terms of how they would like these processes to be carried out. And then record keeping. A dispenser should keep records of disposition of an illegitimate product for no less than 6 years after the conclusion of the disposition. And just as an aside, disposition is defined in the law and is really kind of what I would call disposal. It's basically disposing of the product or using a third party like a returns processor, or reverse logistics processor, or the manufacturer, et cetera, somehow arranging for that product to be disposed of or destroyed. There is a clause here also in the law about an electronic database. A dispenser may satisfy the requirements of the paragraph also by developing a secure electronic database or utilizing a secure electronic database developed or operated by another entity. I think that this is both in part for record keeping, but also once you get to serialized product, depending on what the dispenser chooses to do under the requirements, that you could do this somehow electronically through your own system. There is an exception, though, that I want to note, and this is not just for record keeping, but for all of the suspect and illegitimate product investigation requirements, as well as product tracing, which I'll get into in a moment. And this exception is for healthcare practitioners. Essentially, healthcare practitioners that are authorized to prescribe or administer medication under state law or other licensed individuals under the supervision or direction of such healthcare practitioners are exempt from the product tracing requirements as well as from the verification of suspect and illegitimate products. Which brings me to the second critical date for dispenser compliance. And you've heard us talk a lot about transactions, transaction history, information, and statements. Those are the TI, THTS that you see on the slides are basically the shorthand that has sort of come to be commonplace across the supply chain as we talk about these requirements. A dispenser may have a third party perform some of this function in terms of maintaining the documentation or the TI, THTS. However, you do not, using a third party to perform some of these functions in terms of the product tracing requirements doesn't relieve the dispenser necessarily of any investigation or verification obligations. So if a suspect or illegitimate product investigation were launched and your participation was requested, the dispenser would still have to find a way, either with their third party or some other way, to participate in that activity. A system still will have to be in place to segregate and investigate suspect products, and verification, quarantine, investigation, disposition, notification, all of that is still going on in July as well. Product tracing, in terms of phase, and I like to call this all phase one before we get to serialization. It does require all parties, manufacturers, wholesale distributors, dispensers, and repackagers to pass, capture, and maintain certain information with respect to each transaction. There's an emphasis on lot level information at this point versus later on. We talk more in the requirements about serialized numerical identifiers or unit level activity. Now, under this law, pedigree or product tracing requirements, as I mentioned before, will be triggered by changes in ownership between trading partners, not just changes in custody or possession. And there is also a new definition of affiliate that you might want to look at regarding intercompany transfers, particularly if you are also dealing in a wholesaler environment or another type of entity. Transaction information and transaction history are defined here for you in detail. They're fairly self-explanatory, one being kind of all the elements associated with that specific product, and the other, transaction history, being really the transaction information for the prior transaction back, going back as far as the manufacturer. And there are different sort of nuances of what's included for some of this, depending on the specific transaction, and some of that is spelled out in the law. Transaction statement is a fairly new concept with the DSCSA. We never really saw this with pedigree before, and this is a paper or electronic attestation by the entity transferring ownership. And it's basically saying that your supply chain partner is authorized under the Act, they received the product from an authorized party, they received the transaction history or transaction information and statement from the previous seller, they didn't knowingly ship suspect or illegitimate product, they have all the systems and processes required in place, and they did not knowingly provide false transaction information or alter the transaction history. And this is really just an outline for you of kind of all of the, just the steps really that are included in the DSCSA. Each business really has to provide TITHPS to the subsequent owner. Each business is required to receive it. Everyone has to maintain and capture this information for 6 years. And for manufacturers, wholesale distributors, and repackagers, it begins in January. For dispensers, your members, it begins in July. Obviously, I think you will probably be hearing from your wholesalers, or your members will be hearing from their wholesalers and manufacturers earlier than July in terms of, potential testing of how information will be received, also potential, explanations from their suppliers about how this information will be received and what they can expect. There are also several exemptions, and it's more extensive in the actual statute than what's here. This is just to give you an idea of some of kind of the key exemptions from the traceability requirements. Blood and blood components for transfusion, radioactive drugs, intravenous, medical gases, compounded drugs, which are all covered under Title I, dispensing drugs pursuant to prescription, so if you're basically dispensing to a patient, and then medical convenience kits and combination products, sterile water, and products intended for irrigation. One thing I also wanted to touch on that I did talk about briefly before was third-party maintenance. The dispenser may enter into a written agreement with a third party, including an authorized wholesale distributor, under which the third party confidentially maintains the TITHPS required under the law. So it is possible for your members to contract with a wholesaler or another third party to do some of this work regarding the product tracing. But again, the dispenser must maintain a copy of the agreement. And again, the dispenser is not relieved of the obligations to meet the law's requirements. Also wanted to touch just on returns for a moment. Return is defined as providing product to the immediate authorized trading partner from which such product was purchased or received, or to a returns processor or reverse logistics provider for handling of such product. This is a little bit new in terms of industry practice. While some of this has been encouraged and maybe even required in certain states, this is the first time that we're seeing a return as defined under the statute being something specific to that original customer seller trading partner relationship. So essentially your customers or your member of the dispenser will be providing return back to its original seller or supplier. And then there are some returns requirements for specific to dispensers. Saleable returns are broken out from unsaleable returns or non-saleable returns rather. In terms of saleable, they may return product to the trading partner from which it obtained the product. They do not need to provide the TI-THCF with the return under the law's requirements. And then just so that they are also aware, with regular transactions or forward transactions, dispensers shall capture the transaction information, transaction history, and transaction statement as necessary to investigate a suspect product and maintain such information, history, and statements for not less than 6 years. So whether the dispenser is doing it on their own or through third party, they will have to receive and capture TI-THCF as necessary so that they can perform, or help investigate a suspect product and have those records on hand for 6 years. And then non-saleable returns, they may return a non-saleable product to the manufacturer or repackager or to the wholesale distributor from whom such product was purchased, or to a returns processor, or to a person acting on behalf of such a person. And this is all without providing TI-THCF, or the transaction information, history, and statement. Essentially, non-saleable returns are defined, I believe, in the statute, and they are essentially expired or a product that is no longer going to be eligible for dispense to a patient. This is just an example of something that we have available also on our website. This is a transaction scenario deck that would be available to your members and to you as well if you're interested in checking it out. But this is just one. I just included two kind of basic slides for you here just to kind of give you an idea of the basic flow of product and data as we see it under the new law. So direct purchase to dispenser, we did direct purchaser because that's basically the bulk of the transactions that HDMA distributor members are involved in. A direct purchase distributor would be purchasing products from a manufacturer and would be selling directly to a dispenser, which includes a practitioner. And this would just show, and we have several of these in our deck on our website, but this would just show the flow of product and the flow of ownership and the flow of data. And these are available in more detail in that tool that we've developed. And if you go to the next one, this is the multiple distributor one. So this just gives you an idea, sort of, a picture's worth 1,000 words, and in terms of watching the flow of product and kind of mapping out what types of entities and where the product is going, essentially, along with data and ownership in the supply chain. With that, I'm going to turn it over to my colleague, Anita Duca, and she's going to talk a little bit about FDA and some other resources like this that HDMA has worked on.
Thanks, Liz. As you've probably figured out, FDA is responsible for administration and oversight of the DSCSA requirements. And so the statute also outlines certain specific elements and responsibilities and deadlines for FDA for how they're going to go about doing that. So I'll give you a very broad overview in the next few slides. First out of the chute is the 180-day requirement for guidance on suspect and illegitimate products. FDA did issue one on June 11th. It was in draft form. We and others have commented on it, and we're now waiting for a final version. Then on January 1st, FDA is responsible for establishing a database of authorized wholesale distributors. And we're expecting that to be synced up with the wholesale distributor annual licensure reporting that is also effective on 1/1/15. I think Liz mentioned that earlier. Then 1 year after enactment, FDA is on point to issue draft standards for the TI-THTS, and by that we mean a guidance containing these standards. This particular guidance, due November 27th, is really important, we believe, for the whole supply chain because the requirement for providing this information is one of the most complex features that is going to take place in the first year of enactment. So we're hopeful that we're going to see that very soon. Also, on November 27th, the 3PL licensure reporting becomes effective. That is parallel to the wholesale distributor licensure reporting. Not quite clear why they put in two different dates, but that's what is in the statute. Then next year, 2 years after enactment, some other things must take place. FDA must establish a regulation of wholesaler and 3PL licensure standards. And these are going to be standards that wholesale distributors and 3PLs must meet in order to obtain a state license. So the state must follow these standards. FDA must also establish several processes. They include a process for waivers from the data exchange requirement, and the example given in the statute was if there might be, say, an economic hardship. There is also a process for product identifier exceptions. And again, as an example of that, it might be you might want to request an exception if the product is just too small to fit the identifier. And then there's sort of a general catch-all phrase about a process for exemptions for meeting certain DSCSA requirements pertaining to other transactions and products. FDA is also on point to issue a guidance on grandfathering, and what they mean by that is what you should do with product that doesn't have an identifier but is in the supply chain when the tracing requirements go into effect. So they'll be issuing something along those lines. And then FDA is also expected to hold at least 5 meetings, public meetings, and the first not earlier than 1 year after enactment. And the way the statute outlines this is that they are highly technical topics that FDA is supposed to take on, such things as systems attributes for unit-level tracing, or is electronic tracing feasible, cost-effective, and other similar very, very technical topics. In our next slide, there are a series of deadlines where there's not really a specific date. There's sort of general guidance about when it takes place, but not a specific date. The first is a guidance for unit-level traceability. That is supposed to be issued not less than 18 months after a public meeting on systems attributes. They are also expected to perform an assessment of small dispenser capabilities. And again, there's sort of a broad guideline there that would take place not later than 18 months after the final guidance on suspect and illegitimate product and unit-level tracing. They must also update the guidance not later than 18 months after conducting a public meeting on interoperable standards. And this guidance is supposed to be looking at tracing and those kinds of topics. And then FDA is also responsible for establishing one or more pilot projects. And again, this is intended to help gather information on unit-level tracing and standards for the interoperable data exchange. So you can see there's a lot of technical work that has to be done and that FDA is responsible for conducting. Although not required in the statute, I thought I'd mention a couple of activities that FDA is also conducting that we are hopeful will be helpful. The first was that on October 8th, they issued a draft guidance. This has quite a wordy title, the effect of the Section 585 of the Food, Drug, and Cosmetics Act on drug product tracing, and et cetera. What this is essentially a discussion of how state preemption is going to work or how DSCSA guides along the preemption of state activities. So we are looking at that now. We will probably file comments that are due December 8th or 10th. The next one I just wanted to mention is that publicly in a couple of different forums, FDA has stated they will issue a guidance on wholesale distributor and 3PL licensure reporting. And again, that's linked to the reporting that we talked about it being due on January 1st. So that was it for what FDA is required to do that I wanted to mention today. Just so that you have some further information, we also wanted to tell you what we've been working on since enactment. We have 2 slides on this. I am not going to go through every single one of these one by one, but just to tell you that here at HDMA, we've been working in 3 general areas. The first is guidelines that support compliance for our members. Several of the documents and meetings and so forth that you can see here are along those lines to help our members, for example, in the electronic data exchange, how would they set that up, and those guidances along those kinds of ideas. The second is just more general information for educational or communications purposes. We've been holding webinars. We have educational sessions at our meetings and that kind of thing to try to do as much as we can to help everybody understand the DSCSA. And then the third bucket is the interactions with FDA. We have in both verbal communications at meetings and in written comments and other written letters to FDA, we've been discussing our interpretations and recommendations to FDA for how they should establish policies on the DSCSA. So these are listed here. Again, they are most of these are available on our website. So that if you want to refer to them, you can see them at HDMA's website. You should see that listed here under the additional resources. There's links to just about all of those that are listed there. The only ones that aren't there are any kind of public meetings we attended, but you can find them there. And we also wanted to let you know that we do have an upcoming very comprehensive traceability seminar next week. And if you're interested in that, you, of course, can look into that. We'd be happy to have you there. Okay, that completes what I had planned to say and completes what we were planning to do on this webinar. So I'm going to turn it back to Perry and see if he has any further remarks. And also, please feel free to type in your questions for us.
Yeah, thanks, Anita. Thanks, Liz. Again, as I said earlier, our main point of this program was to help you guys understand more about this law and what you need to be working with your members on. You know, hopefully this has helped at least raise some other questions for you. I think one of the things we strongly encourage you to do is to have your members actually reach out to their wholesalers and find out about what's next, because ultimately the answer is that they're going to be a big part of supporting a lot of pharmacy, hospital, clinic, physician practice type of activities in this area. I think with that in mind, with the absence of questions, I do have, you know, kind of one question, Liz, and Anita, maybe you both can answer this a little bit. You know, is there a way to characterize, this is a good summary of what HDMA has been doing, but is there a good way to characterize what our wholesalers have been doing in the past few months to kind of get ready for this law? I think their focus has really been on that first part, which has to have them working closely with manufacturers.
Yeah, I would agree with that statement. I think our wholesaler members are essentially all primary distributors, so buying directly from the manufacturer in almost every case. They have been working on understanding the law, on working through the transaction scenarios and some of the issues that, just in terms of interpreting what the requirements are, both for them and for their trading partners. And then I think they've been mostly focused, as you mentioned, on that manufacturer to distributor transaction. And, what happens there? How is data exchanged? How is product moving? How do we keep the supply chain safe and secure, compliant with the requirements, and still moving product efficiently and safely so that it can get to your members, the dispensers, and their patients?
Yeah. Go ahead.
I would just add there's also a lot of communications between the manufacturers and the wholesalers about some of the DSCSA is not 100% clear on how to interpret certain definitions and certain requirements, so they're doing a lot of work together to legal analysis and that kind of thing to come up with appropriate interpretations so that everybody has a consistent frame of reference for how you define the difference between a manufacturer and a co-licensed partner and those kinds of things. So there's a lot going on that side of the house to try to figure out how we're going to all do this in a consistent and coherent fashion.
And I think the point of the question was to help illustrate something in that over the course of the last year, manufacturers and distributors have used a lot of time to figure this out. And granted, a lot of it has been kind of help understand the nuances of law. As an example, we developed a guideline for the 856 EDI transaction set. And based on our evolving interpretation of the law, we had to change that. But the main point is it took roughly a year for us to get to the point we're at now. Starting January 1, we're going to be implementing that with manufacturers. It's over that 6-month period, a much more concentrated period, that distributors are going to be working to do this with the dispensers. One of the questions, we have, I guess, 2 questions here I wanted to try to touch on. One is about an exception where lot number information does not need to be included in the transaction information when a dispenser purchases from a direct purchaser, such as one of the big wholesalers. Is that true? So Liz, why don't you go ahead on that one?
Sure, yes, that is true, and that's included in what we would call the wholesale distributor requirements, and specifically in the direct purchase distributor requirements that are spelled out in the statute. Essentially, if a distributor is a direct purchase distributor, so if ABC or Cardinal, as you gave example, if they buy directly from the manufacturer and then sell to the dispenser, they do not need to, there's an exception, so they do not need to include the lot number in the transaction information or transaction history that you, the dispenser customer, receive.
That's laid out in statute, right?
Yeah.
Okay. Well, in light of the fact that there aren't any other questions at this point, hopefully this has been an effective hour for you guys. It's meaningful to us to help convey this information to you. I would say that if you have any additional questions, if you would like any support whatsoever in educating your own members, we would be glad to help you. And please feel free to reach out to myself, to Liz, or to Anita to try to set something up. We appreciate your time today, and as I mentioned, hopefully this presentation and the audio will be available at the end of the week if you want to review it one more time. Thank you for your time, and we look forward to working with you on implementation of this law. Thank you.